Good morning, everybody. It's Liz Barr from Red Square Medical. Thank you for taking the time to watch this short video about how your inventory will be managed going forward from the 1st of January 2026. So I just wanted to let you know why we are changing the way that we manage our inventory. First things first, in 2025, we've done a complete and major review of all the ship's inventories. We've done this because there's been excessive wastage in previous years. We've now got a lot more data available to support our resupply orders, and we can base that on usage, we can base it on itinerary, we can base it on the seasonal requirements, and that will help us make sure that we're making the most of our resupplies. And we also wanted to make sure it was updated to reflect the best practice that is currently in place for patient care. The main challenge we had doing this review is that we cannot cater for every possible outcome. So we focused on the main medical emergencies and also the most common day-to-day illnesses. So first things first, this is just what your current inventory looks like. We've taken this screen grab from Scenic Eclipse. It'll be something that you should all be super familiar with already. Currently, what we use with the medication code is whatever the supplier's code is on the sales invoice that they send through. Moving forward from the 1st of January 2026, we'll be using multiple suppliers to ensure a more timely and reliable supply chain. So we will be using our own specific codes that will ensure consistency across our reporting and also consistency across our ordering so that we always know what we're going to be getting. And you will have access to the spreadsheet that has that single point of truth on it, so you always know what you're supposed to have, so that when we order it, we can match it up to our own codes. The control level won't change. That essentially dictates whether or not a medication needs to be prescribed or is an over-the-counter. And that just has an impact more on what you're able to prescribe and dispense through your account on Praxis. So when we're listing medication, this relates to the description of the item and will only be working with generic names. If you want to add a trade name / brand name in brackets afterwards, you can. If there are no generic names, then we'll work with active ingredients. And the reason we're doing this is to prevent confusion when searching for medications to prescribe. Often the trade names or the brand names don't always reflect what's in the medication, which means that we are sometimes reordering things that we've already got in stock, but as it's listed under a trade name, we don't know we've already got it in stock. So all of your consumable and diagnostics will be listed underneath this heading, as well as your medication. So the next column along that you see is the category, and for medications, essentially what we've tried to do is just group them together in their common categories. If you want to search to see what have I got in the way of emergency or ACLS medications, or where are my antibiotics and antibacterials. And for your consumables, we've grouped it by the type of consumable it is. So you can search for all airways or all items related to breathing, all your bandages, wound care, that sort of thing. So on the storage location category, what we have done is allocated pharmacy, which is your ready use. This is what you've got in your cupboards in the medical centre. We've allocated controlled drugs cupboard. This is what you're keeping in that locked compartment in the doctor's office. Your emergency medications and your fridge items. For your consumables, these are billed by modules. So it could be that it's emergency kit, it might be general supplies, diagnostics, wound care, bandages, etc. And moving on to the quantity in stock, this should always be recorded as individual pieces, not packs or boxes. So for example, if a box of acyclovir comes in boxes of 56 tablets and you have 2 boxes, then the quantity should read 112. That means if the doctor then prescribes 16 tablets as part of their prescription, when they dispense it, 16 tablets will come off the inventory and we'll know exactly how many tablets we've got left in stock. The next column is the reorder point. Historically, we've not used the reorder point column. However, from the 1st of January 2026, we will be using it to ensure compliance with flag state regulations. The Bahamas flag state have a maritime notice that basically says that we have to carry a certain amount of stock for the number of crew that are on board. So using this reorder point column, it tells us what the minimum amount of stock is that we have to carry to be compliant with the Bahamas flag state. The rest will be blank and orders will always be based on usage, and you can always request a usage report from me at any time, and we can generate it from anything from 1 week to 4 years worth of history. And what that helps us do is see how often am I using this medication, how often do I need to be thinking about reordering it, and do I need to order it in the quantities that I originally thought. So it's a really useful way of monitoring usage and making sure that we're only ordering what we actually need. The next column along are lot numbers, and historically, again, we've not used this tab, but from the 1st of January 2026, all lot/batch numbers must be entered for all items. They can be found on the item itself or on the resupply sales invoice. And we need to do this as part of our regulatory compliance to track items that may be subject to recall. That then allows us to contact the patients who've had these items prescribed and let them know that they need to take them to their local pharmacy for destruction or return them to their originator, which would be, in our case, the medical centre on board. The majority of all medical items will have an expiry date. If it does not have an expiry date, though, then you can simply enter something really, really long into the future, like December 30th, 2099, or you could just leave it blank. Both will work and stop it from being flagged up as an expired item. So often we have multiple batch numbers and expiry dates on certain items, and in the current system you'll see that we have lots of lines for the same item. And the reason for that is so that we can monitor the different batch numbers and expiry dates for the same items. The problem with this means that we're not always prescribing and dispensing the items that have the shortest expiry, which makes a mess of the inventory and creates unnecessary wastage and work when doing stock takes. It's super important that we always make sure that we're using the shortest expiry first. So stock rotation and stock management in that respect is critical to ensuring that we're not throwing out loads of items that had a short expiry that we could have actually used. So the new system moving forward, we will still have multiple lines for each item to manage the different batch numbers and expiries. But what we need to do is understand how we're going to manage those different expiries and batch numbers. So you will import what has the soonest or the shortest expiry date as pharmacy stock. You must make a note of the expiry and batch number when you're prescribing and dispensing to ensure it matches what you actually remove from the cupboard and give to the patient. And because we are managing multiple lines for one item, what we also need to do is input what has the longest expiry date as spare stock. So we're doing it in capitals, so it sits out quite clearly when you're searching through for your prescriptions. And this is something that will help us make sure that we are only prescribing and dispensing from pharmacy stock, not spare stock. And again, it's super important that you check that you are dispensing the correct batch number and expiry date according to the prescription that you've used on board. So with those expiry dates, when the pharmacy item runs out or expires, then they should be removed from stock and destroyed, and then you will need to update the next available expiry date and change it from spare stock to pharmacy. This is easily done by going into the item and editing it and just changing that location from spare stock to pharmacy. This method of stock rotation will ensure that we are only using the soonest or shortest expiry dates and can also track the batch numbers should there ever be a product recall. There is a column that says location, and this will default to the ship that you are on, and you cannot change this. And that's only because I have oversight on all ships. So when I go into the inventory, I see all of the ships, and I need to be able to separate out your inventories when I'm doing my usage reports. So the next steps then, moving forward, you need to ensure that your inventory is as accurate as you can get it by the 15th of December 2025. We will then contact you to state that your inventory will be going offline and you will need to keep manual records of what you dispense so that it can be removed once the update has been completed. We will then update your inventory and upload it back into Praxis. We will then send you an alert to say that your new inventory is online, and you will need to manually adjust the quantities to reflect what's been dispensed during the time the inventory was offline to ensure accuracy. I know a couple of the ships have already gone through this process, so thank you very much. You can ignore this little bit here. But for those of you still going through, this is where we're up to. So moving forward, there's some additional things that you will need to know, and this will all come out in an email as well to remind you. You're going to get a list of all the items that have been removed from the approved inventory after the review that we've conducted this year. As these are used up or expire, then you'll not be able to reorder them, and they will not show up in your new inventory on Praxis unless you've still got stock in which case they will show up with a code of NOAI, meaning not on approved inventory, and that just makes you understand that these items are coming off the inventory. You'll also be given a list of new items that have been added to the inventory. Some we have to carry to be compliant with the latest flag state guidelines that came out earlier this year, in which case can you please place those on your next resupply order. Others are available should the situation dictate that you may need them, and you can order them through the usual way. So ideally what we're looking at is, again, tracking our usage, looking at our itineraries and looking at the seasons and thinking, how much am I using of this and do I need to order it in? So as an example, we recently had Scenic Eclipse 2 going to an island where malaria was prevalent. So it was a case of providing the correct malaria prophylaxis and malaria test kits. Now, you would not need those if you are operating in the Mediterranean for the next 6 months. So that's what we want to do, is really look forward in our itinerary and think carefully about where we're going and what we're doing so that we can plan ahead for these situations. Any item marked as NOAI is not on approved inventory. So if it's marked as that in Praxis, it means that it is not for reordering. And once it's been used or expired, then we will not be replacing it and we will remove it from your inventory so it doesn't clutter it up. Moving forward, in the 1st of January 2026, you will have an updated Medform 014 to place your resupply orders on. The resupply process is exactly the same. You'll just notice that it's got our Scenic and Emerald unique codes on it rather than supplier codes. This form will go out in the updated SMS, which comes out on the 1st of January 2026, but I will also send you a copy for your own records, because I know sometimes it can take a while to be able to get access to those new forms. So the process for resupplies then, although it won't change very much, I just want to run through it with you one more time. You'll submit the Medform 014 when it's requested. We'll then notify you once the resupply has been dispatched and provide you with the tracking number. When you receive the supplies on board, you'll need to check that all items detailed on the sales invoice are present and correct. Any discrepancies should be reported immediately to me and I will investigate. You will then need to go into Praxis and update the inventory with your new items, and you can get more information about this in 16.2 of the Fleet Medical Administrative Orders. As you already know, as part of our compliance piece, we have to submit regular checks and controls on our inventory. These checks and controls will also be updated from the 1st of January 2026, and we have worked really hard to make these easier to submit them. So you will be sent the new links at the end of December, ready for the new year. The idea is that instead of having to go through every single box and ticking it all off, you'll have a live spreadsheet. And this will be linked to the checks and controls, and you will just use that to manage the following modules. So from weeklies, we'll be doing the emergency grab bag, and if you're on a scenic vessel, you'll also be doing the landing bag. On the monthly is the emergency cart, and on the quarterly is the secondary medical position, the paediatric module, and the US public health module. When you click on the checks and controls link, you will still go to the same style form as you're using now, but for some modules you will be given a link to the live spreadsheet, and then you just need to select one of the options underneath. So for example, this is what your checks and controls submission form currently looks like. So you can see that we've got an example from the secondary medical position. It says, please click on this link and ensure that the spreadsheet is up to date with your latest checks and controls. Any items that will expire within 1 month of this submission should be highlighted in red, please. And then you'll just see that you've only got 4 boxes, and that just lets us know all items are present and in date. No further action needed from anybody. All items are present, but some have or will expire. Please see spreadsheet for red dates. So when Red Square Medical look at those dates, we will automatically add them to the next resupply. Or if it's an emergency drug, we will probably ask you to do a local purchase. Then it might be that you tick some items are missing. Please see the comments section on the spreadsheet. And then there's also an extra section that just says see remarks if there's anything else you want to tell us about that. So when you click on that link highlighted in yellow, you'll be taken to the live spreadsheet. So this is what the live spreadsheet would look like. This is a screen grab from one that we've set up for Emerald Azura. So when you click in, what you'll see is that you have an example from the emergency cart, and you can see that the chest drainage kit has expired and was not in the last resupply. That will trigger us to help source one and make sure that your kit is compliant. So what does this mean for you then, and why is it easier? Well, what it means is that once you complete this live spreadsheet, then essentially the only thing you need to do is cite that spreadsheet and highlight anything in red that's going to expire before the next set of checks and controls. On this live spreadsheet, you'll also notice at the bottom that there are tabs for the expiry dates for the oxygen and the date of when the next calibration is due for your medical equipment. We need a single point of truth, and copies of this spreadsheet will not be permitted. And the reason we need a single point of truth is to reduce the amount of duplication of work that you are doing and that we are doing at our end. So ideally freeing up a lot more of your time to concentrate on important things like patient care and medical records. So what happens is all items on this live spreadsheet should be removed from the main Praxis inventory, otherwise we end up double accounting. So we don't need to account for them through the spreadsheet and through Praxis. So if that's what is currently happening, then from the 1st of January we need to make sure that we are only accounting for your checks and controls through the live spreadsheet, and everything else then can go into your Praxis account. Thanks so much for taking the time to watch this short video. We've managed stock control so much more efficiently for 2025, and I think if we work really hard to implement this updated inventory management system, then 2026 will look even better, and we can start spending some of our budget on new pieces of kit rather than wasting it. As always, your suggestions and feedback are gratefully received, so please do let me know how this goes.